I come into the patient's room and introduce myself. I'm CJ Larraz. I'm a student nurse here at the College of Nursing, and I'm going to be performing a soap suds enema today. I have the order to do a soap suds enema on arrival to floor. I would also check the hospital policy. I would identify the patient using two identifiers: the name, Jones Jaguar J, the medical record number, which is 4176352, 4176352. I notice the patient does have an allergy to penicillin. I would provide the patient with privacy, and I would gather my supplies. I would also have an IV pole to hang the enema bag on, and I would also have a bedpan. I would perform hand hygiene. I would don my goggles and gloves. I would fill the enema bag with 750 to 1,000 milliliters of warm water or saline. And I would also clamp the tubing before doing this. I would add in the pure Castile soap. I would gently agitate the bag to mix the solution. And I would unclamp the tubing and to prime the tubing, and then I would reclamp. I would lay the bag on a firm surface or hang it on the IV pole. I would not place it on the patient's bed. I would come to the patient and I would assist the patient into the left lateral Sims position. I would raise the bed and lower the side rails. Then I would also have a waterproof barrier down to prevent soiling the bed. Next, I would take the enema, and in my dominant hand, I would lube the enema 3 to 4 inches, or I lube the tubing of the enema. I would place my hand gently but firmly on the patient's buttocks or hip, and I would explain to the patient to take slow, deep breaths throughout the procedure. I would spread open the patient's buttocks, and I would insert the enema 3 to 4 inches. And if the patient had hemorrhoids, I would instruct the patient to bear down, and I would hold the tubing with my non-dominant hand throughout the procedure. I would raise the bag 12 to 18 inches above the rectum throughout the procedure. If the patient experienced any pain or discomfort, I would lower the bag or reclamp the bag. Once the procedure is finished, I would remove the tubing and clamp the tubing, and I would instruct the patient to hold for 10 to 15 seconds. I would then place the patient on the bedpan. This part of the bedpan would go up towards the patient's buttocks, and this part would go up down towards the thighs, and then this part would go up to the patient's buttocks, and this part would go down to the thighs. And once the patient was done, I would provide them privacy, and then I would document the amount and type of enema, how the patient tolerated the enema, the amount and color of the excess, and then I would document how the patient removed how the patient was left, what position the patient was left in, and then I would remove my gloves and